Welcome and thank you for joining. Me, Megan, myself, Haley, and Lauren make up Group 3, and we will be presenting on homeless individuals suffering from schizophrenia. After today's intervention, you will be able to 1. Identify 3 schizophrenic-related risk factors to contribute to homelessness, 2. Define 3 unique barriers of the problem within the population suffering from schizophrenia, and lastly, recall 2 early warning signs of psychosis that would qualify someone for the RAISE intervention program.
Prevalence of schizophrenia within the homeless population. Prevalence is the existing cases of a disease, which is in this case the number of homeless persons with schizophrenia. Homelessness affected 17 out of every 10,000 people in the United States in 2018. On the other hand, schizophrenia affected 1.2% of the United States population, or about 3.2 million people. Due to the majority of the homeless community being neglected by medicine and the definition of homelessness differing from study to study, the exact prevalence of homeless people suffering from schizophrenia is unknown. In systematic reviews, it is estimated that 4 to 24% of the homeless population does suffer from schizophrenia. The World Health Organization defines social determinants of health as the conditions in which people are born, grow, live, work, and age. In other words, social determinants are the economic and social conditions that influence one's health. The World Health Organization continues to explain these circumstances and how they are shaped by the distribution of money, power, and resources at global, national, and local levels. These determinants are mostly responsible for the inequities in health and healthcare. For homeless individuals with schizophrenia, social determinants include unsafe environments, food and housing insecurities, social isolation, poor health care, poor family and peer support, and low educational level. The National Institute of Health defines risk factors as something that will increase the chances of a person developing a specific disease. Risk factors that affect the schizophrenic homeless population are genetics, childhood trauma, poor family support, substance abuse, and strained community environment.
Schizophrenia can appear in a person suddenly, but it usually happens over time as symptoms worsen. So some early warning signs to look out for would first be depression and the person isolating themselves from their friends and family. The activities they used to like, they're not really interested in anymore, and they're really withdrawn into themselves. They'll also start to exhibit suspicious tendencies and become very hostile towards other people and criticism. Another common sign that indicates a problem would be they have an expressionless gaze, or their face is very stoic and they have trouble regulating their emotions. So for example, they could be laughing at inappropriate times or having trouble properly expressing their happiness or their anger. Insomnia and oversleeping could also be something that somebody is experiencing as an early warning sign of schizophrenia. Someone who is diagnosed with schizophrenia will experience most, if not all, of these clinical symptoms. So over 90% of patients who are suffering from this mental disorder will have delusions that can range anywhere from thinking they're a famous person or a celebrity to believing that there's an alien living inside their brain who's controlling their actions and stealing their thoughts. Another thing that they will experience are hallucinations. Most likely they're going to be auditory hallucinations, as they are the most common form in schizophrenia patients because they'll often say that they're hearing voices in their heads. And then because people with schizophrenia have a hard time concentrating and staying focused, they will almost always suffer from disorganized speech and behavior. So this could be something like they're making up words that don't exist, or they're talking really, really fast, or jumping from subject to subject. And then disorganized behavior is going to be things like abnormal behavior, so like they're not paying attention to their hygiene, they're acting erratic and making impulsive and rash decisions.
The next subject we're going to talk about is barriers of treatment options. Individuals experiencing homelessness face numerous barriers to receiving primary care. Lack of insurance or adequate funds to afford co-payments. Lack of transportation, which is a barrier that leads to rescheduled or missed appointments, delayed care, and missed or delayed medication use. Such delays in care may lead to a lack of appropriate medical treatment and unmet healthcare needs, which can accumulate and worsen health outcomes. The next barrier is difficulty making or receiving information about appointments because of lack of communication methods. There is no address and usually no phone number that is a reliable method of communication. Another barrier is a lack of personal care. Those experiencing homelessness, particularly those with co-occurring mental health or substance use disorders, face stigma that reduces their engagement with care. According to a study done by Clark University, one of the greatest barriers that was presented in hospital treatment of homeless individuals was the lack of personal care. Social service workers say that their homeless clients leave feeling neglected and have said that the care they receive is discriminating. One social service worker, for example, shared that one of her clients reported being treated in a hallway bed as opposed to a room where all of their medical information was discussed where everybody could hear, despite rooms being available. In addition to these barriers, people experiencing homelessness may, with good reason, prioritize immediate needs such as shelter and food over seeking primary care. All these barriers may result in missed or delayed health care appointments, increased health expenditures, and overall poor health outcomes.
To help those individuals who need an affordable and flexible intervention, the National Institute of Mental Health implemented an intervention called RAISE. It stands for Recovery After an Initial Schizophrenia Episode. The program focuses on two different aspects. One, whether or not coordinated specialty care was more effective than care that's currently available in community settings, and two, the best way for clinics to begin using coordinated specialty care treatment programs. That's with considerations for timing and onset of psychosis. Their goal is to help decrease the likelihood of future episodes of psychosis, reduce long-term disability, and help people get their lives back on track so they can pursue their goals. In order to participate in the RAISE early treatment program, one of the requirements is for individuals to have a current diagnosis of schizophrenia. To help diagnose schizophrenia, symptoms are tiered into three different categories: positive, negative, and cognitive. For each of those categories, the warning signs are listed below. Positive symptoms are behaviors and perceptions that the general population does not experience. These symptoms include hallucinations, delusions, thought disorders, and movement disorders. Negative symptoms will appear vastly different. Instead, negative symptoms are a decrease in normal emotions and behaviors. Sometimes these are harder to recognize since it could be mistaken for depression. These symptoms include the flat effect, which is when a person's voice is monotone and their face does not have movement when speaking, lacking pleasure in everyday life, lacking the ability to gain and sustain planned activities, and lastly, they speak very little, even when they're forced to interact. Cognitive symptoms are similar to negative symptoms in that they can be difficult to identify. It includes having poor executive functioning, which is the ability to understand and use information, having trouble focusing or paying attention, and having problems with their working memory, which means that they have trouble using information immediately after learning it. There currently is no cure for schizophrenia, but with the help of an early intervention program like RAISE, individuals can help treat the symptoms, which will allow them to live better lives. RAISE focuses on the importance of treating the right symptoms at the right time. Researchers for RAISE have found that coordinated specialty care is most effective when the patient receives treatment for psychosis as soon as possible, especially after the first episode of psychosis. RAISE is currently implemented in 17 clinics across the United States and serves as a resource for diverse communities.